Hello, good afternoon everyone. So today in this short video we are going to discuss about the pattern of DNB Pediatric Theory exam and how to prepare for it in a concise way. So it has been a matter of concern from the last few years that the DNB Theory practical exam passing rate is very poor. Even students are getting it difficult to pass in the first attempt from theory for theory exam. But if you prepare wisely and if you prepare properly with a proper systematic manner, and if you know how to prepare for it and you focus on the pattern of the exam, then it's not that tough to clear DNB Theory Pediatric exam in first attempt. So many of the students clear it nicely in the last 2-3 attempts. Passing rate has also improved a lot. So I guess students have learned how to prepare for DNB Pediatric Theory exam. So in short, there are 4 question papers on day 1, 2, 3, 4. Dates have already been announced for this session. It's from 21st to 24th of December 2022. So each paper contains 10 questions. Each question contains 2 short parts, part A and part B. In short, there are 20 short notes in each paper. Each short note comprises of 5 marks. So total 100 marks paper is there. So there are total 4 papers, paper 1, 2, 3, 4. So total 400 marks is for DNB Pediatric Theory exam. The distribution of topics in different papers, it varies. Rough distribution is mentioned in DNB website, and you can even go through past year papers, but there is no hard and fast cutoff like infectious disease to be asked in paper 2 or paper 3. It can overlap, and paper 1 usually comprises from basic sciences part, statistics part, and all those things like embryology, physiological part, and biochemistry, biochemical cycles. But one thing you should understand, from where they will ask NR Physio and Biochem, from your core pediatrics only. Like you are reading respiratory system and they will ask embryology of lungs. You will read cardiovascular system, they will ask embryology of heart. Okay, you will read cardiovascular system in detail, they are going to ask physiology of cardiac cycle in detail. So the topics are from that part only, and it's obvious that if you are doing post graduation in any subject, you should know anatomy, physiology and biochemistry of that particular organ system as well, like respiratory, cardiovascular, neurology, everything. So that is not anything out of the box. Okay, sometimes some questions are there which are quite tough, and it's not possible to read embryology thoroughly from first word to last word, but you have to go through those aspects, and those are scoring questions actually, because embryology, if you learn few steps, you know how it's big, what is the step-by-step process, so you can write it easily and you can score a good marks in those questions also. Statistics, okay, it's fine that every year some new questions are added, but if you go through last 5 to 10 years question papers, then maximum of them will get repeat in your exam also. So this distribution is not that exactly it's not overlapping, it's commonly overlapping, especially in paper 2 and 3 you can't differentiate, but yeah, it's fine. If neonatology is going to come in paper 2, then it's going to come in paper 2, but sometimes they can even ask in paper 3. So you can go through the past year papers and make a rough idea, make a list, and get a rough idea that which section is asked in which paper. So for those 4 days it's quite important. Just now it's not important that which system or which topic is asked in which paper, but for those 4 days, like tomorrow we are having paper 2, so today what you should read, so for that part is important. Okay, now what to read and how to begin for beginners, especially if you have not started reading properly till now, then you should get Xerox or get print of past 5 to 10 years, or get print of the past 10-year DNB Pediatric Theory papers. It's available on NB site as well, or on various WhatsApp or Telegram groups, or from your friends you can borrow, from your seniors also, and go through those papers once. Like paper 1 you have started, paper 1 for all those 10 years, or for beginners who have not yet started reading, I should recommend only for 5 years. You should go through 5-year question papers. Like 5-year comprises of 10 sessions, because DNB Theory is conducted every 6 monthly. So if you go through 5-year papers, you are having 10 session question papers with you. Each session 4 papers, so total 40 question papers. 40 question papers, each paper 20 questions, like 800 questions or 800 good big topics and important topics you are having with you now. So you should go through them first thoroughly. You should search answers. It's not that easy to find answers of those questions. Like in a paper, if you're having 20 short notes, 10, for the 10 you will find answer in any of the textbook you are reading, like in, or even in OP Ghai or Piyush Gupta or Nelson, whatever you are reading, you will directly get answer of those 10 questions. For next 5 questions you have to search a little bit. You have to just go through those topics in various books, and you have to decide that you have to read it from Nelson or Piyush Gupta or OP Ghai or whatever book you are reading. But for 3, 4, 5 questions maximum, those questions are sometimes out of the box, totally new questions related to recent advances or any recent guidelines. So for that you have to even search on internet or various websites. Like IAP website is there, all the guidelines which they are releasing day by day, it's been added there, so you have to go through those guidelines, or even through general Google search you have to go through some, but read from any authentic website only, like NCBI or any good article, not from any of the presentation but PPTs available or social media. So first of all, make a list, and then just on that question paper, in front of that question you have to mention that question number 1 I have to read from Piyush Gupta, page number this, or Nelson, page number this. Okay, so this is the first thing you have to do now, and go through all the questions, read them once from any of the textbook you are reading. If the answer of that question is not available in a particular textbook, then please, it's my humble request, just make notes of that particular topic, because a day before exam it's not possible to go through 3 or 4 books or go through any online material. So if like cystic fibrosis or diagnosis of cystic fibrosis, answer you will find in any of the good textbook. But if question is asked like recent advances of bronchiolitis management, so it's not given anywhere exactly that these are the recent advances in bronchiolitis management. So for such questions, I'm giving just an example, so for such questions you have to prepare notes, so it would be easy for you to revise before exams. Okay, so the conclusion is just go through 5-year question papers. Again, I am requesting you guys, don't try to read everything, because it's not possible. Even if you read everything, it's not possible to retain at the end of the day. And just before exams, it's going to be very, very hectic. 4 days constant continuous exams, no gap between any 2 paper, and the exam gets over in the evening time around 5 p.m. or 6 p.m. and next exam next day morning or next day afternoon at around 2 p.m. so it's almost impossible. And one more thing I would like to mention, that big units like neonatology, cardiovascular system, and central nervous system, neurology, these 3 topics you should revise them thoroughly before exam, because during those 4 days, in those 4 days it's not possible to go through them. If you start neonatology, your whole day is going to be wasted in that only, and other topics you will miss definitely. So again, just make it a note that neonatology, cardiovascular system, and neurology, these 3 topics you have to read thoroughly now. So even if you don't revise before exam, you are going to attempt at least common question, basic questions. Okay, so these are the few tips I would like to share with you, and in future also I will be sharing, and you can also ask your questions or doubts in comment box. Okay, thank you very much, all the best. It's my request now, it's high time, please start reading, and you all can do very nice, and you can all pass DNB theory exams, pediatric theory exams in first attempt. Okay, thank you, all the best.